You're taking your medications, following your doctor's orders, maybe even on biologics costing thousands per month. But here's the reality. You're not getting better. You might be managed, but you're not healing. And there's a reason for that. What if we told you that the very medications meant to help you are actually pushing you further from remission? That there's a pharmaceutical vicious cycle keeping you sick, and your doctors either don't see it or don't know how to break it. After 7 years of clinical practice, working with thousands of autoimmune patients, we've identified the exact pattern that keeps people trapped. And we've developed a protocol that breaks that cycle with measurable timelines. Psoriasis, 2 to 8 months. Rheumatoid arthritis, 18 months. Multiple sclerosis, 18 months possible. Type 2 diabetes reversal, 6 to 12 months. But first, you need to understand why nothing you've tried so far has worked. Let us show you the pattern we see in nearly every patient who walks through our door. Step 1. You develop symptoms. Joint pain, fatigue, skin issues, elevated blood sugar. Step 2. You're given a medication to suppress those symptoms. Step 3. That medication depletes specific nutrients. Metformin flushes out B12 and magnesium. PPIs block absorption of everything. Statins deplete CoQ10. Antihypertensives flush electrolytes. Step 4. New symptoms emerge from nutrient depletion. Neuropathy from B12 deficiency. Muscle pain from magnesium depletion. Fatigue from CoQ10 loss. Step 5. You're given new medications for these new symptoms. Step 6. Those medications deplete more nutrients, create more symptoms, require more drugs. This is the pharmaceutical cascade, and every single medication takes you 50 steps backward in health. Patient comes to us on 3 diabetes medications, 2 blood pressure medications, 1 PPI for reflux, 1 statin for cholesterol, 2 painkillers for neuropathy. That's 9 medications, each one creating side effects that require the others. And here's the part that should terrify you. This is considered good management in conventional medicine. So if pharmaceuticals aren't the answer, what's the real problem? Most autoimmune diseases follow the same pathogenesis sequence. It usually starts in childhood, sometimes even before birth if your mother was deficient. Stage 1. Long-standing vitamin D3 deficiency, often decades before diagnosis. Stage 2. Metabolic syndrome develops. Insulin resistance, low-grade inflammation, gut dysbiosis. Stage 3. Triggering infection. EBV, bacterial, parasitic, fungal, usually a combination. Stage 4, and this is critical. Those infections create protective biofilms in your gut. These biofilms actively block vitamin D absorption. This is why you can take 2000 IU of vitamin D daily and your levels barely budge. It's not that you're not taking enough, it's that your gut can't absorb it. Stage 5. Vitamin D receptor dysfunction. Genetic polymorphisms plus acquired resistance. Stage 6. Immune dysregulation. 13 dominance, T regulatory cell insufficiency, autoimmune attack begins. Stage 7. Tissue damage. MS attacks myelin, RA attacks joints, psoriasis attacks skin. Same root cause, different target organs. Now here's what conventional medicine does at stage 7. They give you drugs to suppress your immune system, but they never address stages 1 to 6. They never clear the infections, they never fix the absorption, they never address the vitamin D resistance. You can't medicate your way out of nutrient deficiency. Here's what we do differently. When a patient comes to us with rheumatoid arthritis, we don't just see RA, we see their complete blood work. And what we usually find? High eosinophils equals parasitic burden. Liver flukes, roundworms, tapeworms. High neutrophils equals viral load. EBV reactivation, other herpes viruses. High lymphocytes equals fungal overgrowth. Explains brain fog, depression. Fasting insulin, 14 micro international units per milliliter. Insulin resistance should be under 5. Triglycerides, 187 milligrams per deciliter. Metabolic dysfunction. HbA1c, 6.2%, pre-diabetic range. Vitamin D3, 22 nanograms per milliliter, severely deficient. Parathyroid hormone, 78 picograms per milliliter, elevated, signals D3 resistance. Ferritin, 18 nanograms per milliliter, iron deficiency from chronic inflammation. This person doesn't just have rheumatoid arthritis, They have multiple infections creating biofilms, metabolic syndrome, severe nutrient deficiencies, vitamin D resistance, chronic inflammation. All autoimmune diseases are the same disease, same root pathology, different tissue targets. MS patient, check their blood work. They have metabolic syndrome, infections, D3 deficiency. Psoriasis patient, same pattern. Lupus patient, same pattern. Type 1 diabetes, same pattern. So why would we treat them with different drugs when the root cause is identical? We don't. We treat the entire ecosystem. Here's what the protocol actually looks like with real timelines. Phase 1. Loading aggressive management 0 to 4 months. First, clear the infection burden. Systematic gut cleansing, ivermectin, albendazole, metronidazole, fluconazole. We don't waste time identifying specific organisms. We clear everything systematically. 4 to 6 weeks to break down biofilms. Second, fix absorption before loading nutrients. Bile salts 200 milligrams daily stimulates bile flow for fat-soluble vitamin absorption. Betaine HCl 600 milligrams restores stomach acid for mineral absorption. This is the game changer. Same vitamin D dose now absorbs 3 to 10 times more effectively. Third, load therapeutic D3 plus complete cofactor system. Vitamin D3, 60,000 IU 3 to 5 times weekly. Yes, you heard that right. Magnesium, 400 to 800 milligrams daily, required at every D3 conversion step. Complete B complex, methylated forms. Vitamin K, 2 mK, 7,100 micrograms. Directs calcium to bones, not arteries. Mineral balance formula, zinc, boron, selenium, chromium. Omega-3 fatty acids, iodine, 100 to 400 micrograms. Most autoimmune patients have subclinical hypothyroidism. Fourth, address metabolic syndrome. If diabetic, berberine 1,800 milligrams daily plus keep metformin only. If hypertensive, monitor 30 days, taper as BP normalizes. Stop statins immediately. D3 corrects cholesterol naturally. Stop PP is in 90% of cases. Bile salts plus betaine replace them. Cost phase 1, 9,000 rupees per month, roughly $110 plus labs every 3 months, 5,000 rupees. Target, 85% symptom improvement by month 4. Phase 2, disease control 4 to 12 months. D3, reduced to 60,000 IU 2 to 3 times weekly. All cofactors, continue daily. Pharmaceuticals, begin systematic elimination based on blood work. Every 3 to 4 months we check. Ionized calcium, safety indicator number 1. PTH, safety indicator number 2. If it stays normal, you're safe. Kidney function, vitamin D levels, HbA1c if diabetic, inflammatory markers, CBC differential. Typical month 6 results. Vitamin D3, 68 to 94 nanograms per milliliter. HbA1c, 7.6 to 6.3%. Eliminated 2 of 3 diabetes medications. Joint pain reduced 60%. Energy returning. Skin clearing if psoriasis. Cost phase 2, 6,000 rupees per month, roughly $75. Target, 95% remission by month 12. Phase 3, remission management, 12 to 24 months. D3, 60,000 IU twice weekly. Cofactors, reduced to 4 times weekly. Most patients pharmaceutical free by this point. Lab monitoring every 4.5 months. Cost phase 3, 5,000 rupees per month, roughly $60. Target, sustained remission, stable blood markers. Phase 4, lifetime maintenance. This is forever. There is no cured with autoimmune disease, only remission. D3, 60,000 IU once weekly. Cofactors, 3 times weekly. Lab monitoring every 6 months. Non-negotiable for life. Cost. Phase 4, 4,500 rupees per month, roughly $55. Yes, it's for life. But so are biologics. Except biologics cost $2,000 to $5,000 per month and suppress your immune system rather than restoring it. Now let's get specific. How long does this actually take for different conditions? Psoriasis, 2 to 8 months. Fastest responding condition. Skin regenerates quickly once inflammation controlled. Patients see visible improvement within 6 to 8 weeks. 80 to 95% clearance by month 8 typical. My psoriasis is 95% cleared. I can wear short sleeves for the first time in 6 years. Rheumatoid arthritis, approximately 18 months. Joint inflammation reduces first, 3 to 6 months. Tissue repair takes longer. Mobility improvements progressive. Pain reduction 60% by month 6, 85% by month 12, 95% by month 18. Of all my RA medications, joint pain down from 8 out of 10 to 1 out of 10. Back to gardening. Multiple sclerosis, 18 months possible. Highly variable based on compliance. Cognitive improvements often first. Fungal burden clearing. Mobility improvements 6 to 12 months. Remission achievable but requires perfect protocol adherence. MS patients often have cognitive impairment from infection burden. This creates non-compliance that prevents remission. Family support critical. Type 2 diabetes reversal, 6 to 12 months. Month 0, HbA1c 7.6% on 3 medications. Month 2, HbA1c 6.8%, eliminated 2 medications. Month 7, HbA1c 6.0%, reduced to minimal metformin. Month 12, HbA1c 5.7%, pharmaceutical free. HbA1c less than 5.7% equals complete pharmaceutical elimination possible. Lupus, scleroderma, other multi-system autoimmune, 2+ years. More complex because multiple organs involved. Slower timelines but same principles. Remission possible with persistence. We need to be brutally honest with you about something. After 7 years and thousands of patients, we've learned this. The hardest disease to reverse isn't MS, RA or lupus. It's patient compliance. Biochemically, we can achieve 90% remission in 12 months. Our clinical data proves it. The research supports it. But clinically, here's what breaks down. Patients miss doses when they start feeling better. Cognitive impairment from infections impairs decision making. Healing crisis in first 2 to 3 weeks feels worse before better. Cost becomes barrier, even though fraction of biologics. Patients stop labs when feeling good. Family pressure. Just take the steroids. This seems extreme. This is why we've built WhatsApp reminder system with daily touch points. Practice management software tracking compliance. Taken, not taken, click tracking. Red flag escalation for gaps. 18 to 20 hour RMO, resident medical officer, availability. The protocol works when you work it, but you must show up for yourself every single day. So before you start this protocol, ask yourself honestly, are you ready to commit to 18 months of daily supplements, to quarterly blood work, to trusting the process even when you don't feel better immediately? Because if you're not ready, that's okay. Wait until you are. This protocol requires active participation. Let's talk real numbers. Conventional treatment. Biologics, $2,000 to $5,000 per month. Additional pharmaceuticals, $500 to $1,000 per month. Lifetime commitment. Ongoing side effects. Suppresses immune system. No path to remission. Annual cost, $30,000 to $72,000. Our protocol. Aggressive phase, 0 to 4 months. 9,000 rupees per month, roughly $110 US. Disease control, 4 to 12 months. 6,000 rupees per month, roughly $75 US. Maintenance, 12 plus months. 4,500 rupees per month, roughly $55 US. Lab monitoring, 5,000 rupees every 3 to 6 months, roughly $60 US. Lifetime commitment, restores immune function, path to pharmaceutical freedom. Annual cost after first year, approximately $720 plus labs. That's not a typo. We are talking about $720 per year versus $30,000 to $72,000 per year. This protocol was designed from the ground up to be accessible at all socio-economic levels. That was intentional because everyone deserves a path to remission, not just symptom management. So here's what we've covered. The pharmaceutical cascade is keeping you sick, each medication creating problems that require more medications. The root cause is the same across all autoimmune diseases. D3 resistance plus infection burden plus metabolic syndrome. The solution isn't suppressing your immune system. It's restoring your entire metabolic and immune ecosystem. Real timelines. Psoriasis 2 to 8 months, RA 18 months, MS 18 months possible, diabetes reversal 6 to 12 months. Cost fraction of biologics, accessible to all economic levels. The catch requires commitment, compliance, and showing up for yourself every day. Your autoimmune disease isn't getting better because the approach is wrong. You're not failing. The system is failing you. Conventional medicine treats disease labels with immune suppression. We treat blood work with ecosystem restoration. Conventional medicine manages symptoms. We pursue remission. Conventional medicine says incurable. We say reversible with the right approach. You have two paths. Path 1. Continue the pharmaceutical cascade, accumulating medications and side effects, accepting managed disease as your future. Path 2. Address root causes, restore your metabolic and immune function, pursue actual remission. Both require lifetime commitment. Only one gives you your life back. If this resonated, hit subscribe. We share clinical data, real patient outcomes, and evidence-based protocols for autoimmune disease reversal. Comment below. What autoimmune condition are you dealing with? How many medications are you on? Your 18-month journey could start today.